this side of the House, we are committed to saving lives and making sure people who use drugs don't die alone. Don't die alone. Don't die alone.
How soon do you anticipate your government will decide on British Columbia's request, which came about a week and a half ago?
Well, it's extremely urgent, so ASAP. And I just want to say that, this is a very, very sensitive issue that is very personal to a lot of people who have lost a loved one. And, I count myself among them. It's really, really tough. And it's emotional and it's hard. And we've got to lead with compassion, with empathy, and with evidence, and work with provinces that are trying as hard as they can to tackle this very, very challenging issue. BC and the federal government agree on the 4 essential, internationally recognized pillars of drug policy, and those are prevention, treatment, harm reduction, and enforcement.
Overdoses have gone up almost 400% in British Columbia, and this so-called pilot project has shown what happens when you decriminalize the use of dangerous drugs like meth, heroin, and crack in public places. They've basically essentially knocked out 2 of those pillars. They've knocked out the harm reduction. They're increasing the harm because of the ease of access of these dangerous drugs, and they've knocked out the enforcement leg. So they've turned a 4-leg table into a 2-leg table, and it's tipping over.
They don't actually care about the facts. They're just doing a policy because they're told they have to do it. And that type of stupidity in our society is very dangerous to our society's success and long-term future. And I can list right now off the top of my head 100 policies that an intelligent group of human beings are instituting that are objectively stupid. It's like we're embracing compliance and obedience, which is translating into stupidity.
Standard legislation now, at either the federal or provincial level, is authorizing legislation, meaning you pass a bill about a certain subject, and it might contain some rules in it, but it also contains the authority, the delegation of authority to the bureaucrats, to an agency of some kind, to the minister, or to whoever, to a Human Rights Commission, to make policies or guidelines or regulations about certain things. And you can't tell by reading the statute what the rules are. The problem that the woke has created is too little freedom. They have us under their thumb. They want us to do this and do that, to use pronouns, not to say this, hate speech, yada, 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 okay? Not enough freedom. I've heard lots of conservatives say, no. The problem under the woke is too much freedom.
I think there is a test case that's currently happening on the streets of every major city, and it certainly feels like the United States,
Right.
Where I don't know if this is necessarily accurate exactly, but it sort of feels like the libertarian argument's been taken to its logical conclusion, ignoring elements of reality. So that's why you have mentally ill people on the streets of Los Angeles and San Francisco and New York and elsewhere, because they've got to be free, right? We can't put them in a mental health hospital because those hospitals used to be terrible objectively, right? So getting people out of the tyranny of that institution, I guess, was a good thing, but now they're on the street taking drugs. And the question is that freedom? Like, part of the conversation around freedom has to involve an element of agency. And then the question is, do you have agency if you're so, let's say, traumatized or so addicted or whatever that is that's causing you to effectively be unable to live a human life, right? If you're living in Skid Row, I don't think that's what freedom is.